And the sin tax reform law is not only a means to raise revenues, it is also a health measure to curb smoking, especially among our youth. Smoke-related diseases are on the rise, and hopefully with more expensive cigarettes, it will reduce the demand And as a revenue measure, the said law is also expected to use revenues raised for the President's Universal Health Care Program. And joining us tonight to explain how the sin tax law impact on health is Undersecretary for Health, Teodoro Herbosa. Good evening, sir.
Good evening, Robert.
So what impact will more expensive cigarettes on consumption and the health of those who smoke?
Well, the greatest impact will be on the decrease of the most common smoking-related diseases. Ito yung lung cancer, heart attacks, strokes, at yung tinatawag na what we call chronic obstructive lung diseases. And actually, there are many more diseases that can be prevented by a regulation like this.
So what other diseases that are caused by smoking?
A lot of the other cancers, breast cancer, of the urinary bladder, and all other types of diseases. We have diseases of the blood vessels that cause toes and fingers to be amputated. These are diseases that we don't want our populace to actually have. And our top 4 killers already, I mentioned, are the non-communicable diseases. These are your heart attacks, strokes, cancer, and even the injuries or trauma from road injuries. All of this can be modified by decreasing the population's addiction to cigarette smoking and to alcohol drinking.
So now, how would higher prices impact on our young smokers?
For many years, Robert, we've tried public health education by warning the people about the bad effects of these products. But none of these efforts have been very successful. And in all countries, what they have done is to impose a regulation or a law. And this is a health regulation as much as a revenue regulation. So it assists the country to actually provide better health care for the people by telling them that cigarette and excessive alcohol drinking is hazardous to your health, and we raise the prices for these cigarettes. And the people that will actually benefit most are the young and the poor. In this country, the most number of smokers are really from our poorer population, and we have about 25% of our smokers coming from the young, less than 15 years old. So this sin tax reform bill targets the youth and the poor.
So how much percentage do we see in the decrease now that the sin tax measure is in effect? How do you see this panning out?
The projections in terms of decrease in the prevalence is about 5%. They say that if you raise the price of cigarettes by 10%, you have a concomitant 5% decrease of smokers. And of the 5% decrease of smokers, there's a concomitant 2.5% decrease in deaths. And when we were doing our computations, we found out that with the passage of the sin tax alone, on the first year, we would have about 17 to 27,000 lives by people who have actually avoided smoking and drinking.
So I just want to discuss a little bit about what actually I've seen, the prevalence right now of e-cigarettes. Can you expound a little bit on what this is?
Well, e-cigarette is just another vehicle of smoking. And there are some brands that claim that what the smoke that comes out is water vapor. But however, the other brands actually still use nicotine and other smoke, hazardous smoke. So for us in the health sector, we consider e-smoking as the same as regular smoking, and it is habit forming, and the smoke emitted is still hazardous even as a secondhand smoke.
So with this, we've seen a lot of this right now. Is it either going to increase the number of people smoking still, even using e-cigarette?
E-cigarette is actually a little bit more expensive than the regular cigarette. So it's a different market that it actually targets. And it's not the market we're targeting with the sin tax regulation.
So now moving on to alcohol, sir. Will the more expensive liquor also lessen the drinking of the youth? And what kinds of diseases are caused by heavy drinking?
Heavy drinking affects mainly our liver, but it also affects behavior. And this is where some of our crimes actually occur. and especially drunk driving, wherein we see many of the road accidents happening and people getting injured. So for us, the next step is really to be able to educate the people as well and avoid what we call excessive or hazardous drinking.
So now, how will the revenues raised from the sin tax law benefit the President's Universal Healthcare Program? And do you think that we will actually reach the target, the revenue target, seeing that we want to decrease the number of people from drinking and smoking?
Well, first of all, for our universal health care, the Congress has already increased the health budget by about 30%, actually about 50% before this President's administration. And with the additional revenues, we actually will be able to raise about 25 to 27 billion pesos. And part of that money will be used to fund the next quintile of poor Filipinos who still do not have PhilHealth insurance. As you know, in the past year, we've been able to enroll already the poorest 5 million families. And there's another set of 5 million families that are called the next poor. And we intend to use a major bulk, about 12 billion of the budget from revenues, to pay for the health insurance of this next poor. And then we also are targeting many health facilities as our population has increased. We now have many health facilities that we need to modernize, that we need to increase the capacity and buy equipment. So these are the targeted health centers in the different provinces, the district hospitals, and even the Department of Health hospitals, which we plan to modernize.
And so a final message, as a doctor, you've seen a lot of surgeries due to this smoking and alcohol drinking. Any advice to our youth and our people, into those who or those who are heavy drinkers, or those who are just about to try smoking or drinking?
This is exactly why we have passed the sin tax bill. We don't want the young to actually pick up the habit. And we now know that the top killers in this country are heart attacks, strokes, lung cancer, and even trauma. These are the ones that can be prevented by modifying risky behavior. And smoking and alcohol drinking is modifiable. So if we have a healthy lifestyle, stop smoking and decrease our drinking, we will all live longer and become more productive with disease-free and healthy lives.
Okay, on that note, thank you very much, Undersecretary Teodoro Herbosa, for joining us on NewsLife tonight. Thank you, sir.
Thank you, Robert.